Hi, Sally Walker here, your hormone and slow age expert. So let's talk about replacing testosterone. So testosterone replacing therapy, as it's called, TRT for short. Okay, so this can be done in different ways. So through the skin, with patches, with gels, with creams, and it could also be through injection. So the patches you'll be changing every day, the gels every day, the creams every day, the injections maybe every second to fourth week, depending on how strong it is. And there are also some capsules which can be taken as well, or maybe just dissolved in the mouth, and you might be wanting to do that twice a day. So these are all prescription based, so you're going to have to talk with your doctors about this. So what is important here is that before you consider doing any testosterone replacement therapy, you must get the blood test done. You want to check what your levels are. And what you're aiming for is somewhere between 500 to 800 nanograms per deciliter, okay? So this is sort of roughly the levels from the age of 50 to 59. That's the age group, really. That's where you want to go. You do not want to go higher than this, okay? I mean, if you're 45 or if you're 40 or 30, then obviously the levels are going to be higher, and you need to obviously talk with your doctor about this. But if you're above the age of 60, then you need to look at these levels. You want to get them checked first. So if you're already one of the lucky men that still have about 500, then you possibly don't want to be replacing, because too much testosterone is not a good thing. But neither is being deficient in it. So there are articles in the blog about heart health, heart disease and testosterone, for example. And it is quite clear that testosterone is really, really important for protecting against cardiovascular disease. So as I said, it's prescription based, and you need to talk with your doc. And as I said, it is so important to get those blood levels checked of your total testosterone, as it's called, your TT. So is there other things you can do? Well, there are, because testosterone is not the end hormone. Testosterone is converted to DHT, which is dihydrotestosterone, which is very potent. We'll leave that one for now. But testosterone is also converted to estrogens. Now, estrogens are great for the women, but for you boys, it's not quite so exciting. You do need some. It's very important for healthy sperm. But you don't need too much of this estrogen. So, and what unfortunately seems to happen as you age and you do store a little bit more fat as the testosterone starts declining, fat cells convert testosterone to estrogen. So you produce an enzyme called aromatase. And as fat cells increase and get bigger, you produce more aromatase. So you're going to convert more of your testosterone to estrogen. So there are aromatase blockers. So you could do this. You could talk to your doctor about getting a prescription based. These are things like letrozole, so aromatase inhibitors. And we know these work because these are used by females with breast cancer as an after treatment to make sure that they have no estrogen. If it's a good thing, I'm not quite sure all these ladies who have no estrogen think that's a very good thing, but this is the standard treatment. But for you boys, it's also being considered as a possibility, especially in the younger years. If you're deficient or you don't have enough testosterone, then this could be a way of doing it. But there are herbals which will affect your aromatase or blocking it as such. Yeah? So one of them is called DIM. And another one is called grapeseed extract. And when you look in the article, you'll see some links to some of these products, so you can read more about these products, which is a good idea. Oh, and by the way, if you are deficient in zinc, your aromatase will be more powerful. So you want to make sure that you're not deficient in zinc, but taking more zinc is not going to block it, but being deficient in it is going to actually increase its activity. So that's another thing that you men need to make sure that you've got a lot of. And the general consensus is that using a little bit of testosterone replacement therapy together with an aromatase inhibitor is possibly the ultimate cocktail for you boys to keep your levels of testosterone somewhere between the 500 and the 800 nanograms per deciliter. But just one thing here, once you start replacing your testosterone, it's a lifetime commitment. You're not going to be able to stop, because the second you stop, then you'll have low levels again, yeah? and is not the silver bullet. Okay, it will do some good, just like estrogen. It will do a lot of good, but lifestyle is equally as important. And there are other articles in the blog about the particular lifestyle choices which are important for you to maintain your own testosterone production. Yeah. So have a little look at those articles, and there's a little bit more in this article as well called Replacing Testosterone. Happy hormones, happy life.